When demographic data on COVID-19 began to appear, some people were shocked that African Americans were dying at far higher rates than white Americans. This outcome should be appalling, but not surprising. Black Americans were already more vulnerable to disease and death because of well-documented structural inequities and racial biases that existed before the pandemic. Racism is harmful to Black people's health. Yet many pundits quickly attributed the disparities to problems created by Black people themselves, to their biological traits and risky behaviors, such as consuming unhealthy foods and drugs. Why is the public so ready to blame Black people for their greater vulnerability? The answer is rooted in a racial mythology that starts with the biological concept of race itself. Theological folklore that God divided human beings into a handful of races was adopted by Enlightenment scientists who claimed to scientifically classify humankind into a natural racial order. The fable that race is a natural creation rather than a political invention still dominates scientific and popular thought. Perhaps the most influential promoters of the biological race myth have been doctors. For centuries, medicine has held that because race is biological, people of different races have different diseases and experience common diseases differently. During the Philadelphia yellow fever epidemic of 1793, the false belief that Black residents had a special immunity justified sending them to the front lines to care for the sick and bury the dead. In the 1850s, Samuel Cartwright, a Southern physician trained at Penn Medical School, claimed that slavery was good for Black people's health because forced labor helped their lungs to function properly. This racial mythology remains embedded in medicine. Common stereotypes include Black people have thicker skin and weaker lungs, are more prone to drug addiction, and make less rational decisions than white people. Racial thinking helps explain why many diagnostic tools make automatic adjustments based on a patient's race, and why doctors routinely undertreat Black patients for pain. Racial myths also shape public understandings of the pandemic. Early on, social media circulated the falsehood that Black people were immune from the virus because melanin in darker skin is protective. When Black people began to get sick, it was replaced by the fiction that melanin makes Black people more susceptible. Whether describing Black bodily difference as innate immunity or innate susceptibility, medical mythology has long supported exploitation of Black people's labor under dangerous conditions and centered the question, what's wrong with Black people, rather than what's wrong with our society. The pandemic has accentuated the need to end this backward ideology so we can build a more equal, humane, and healthy society for everyone.